Should I opt for hair transplant? I'm 19 years old. My hair started falling since I was 15 years old. What can I do to stop it and regain hair in regions where I've lost? My hair is dry and curly. It is a little worse in reality than in the pic.
Thank you for your question. You're 19 years old and you state that you've been losing hair since you're 15. You submitted a face-down photo with the top of your head showing significant hair thinning, and you've also stated that in person it's actually worse than it's in the photo. And of course the question is, should you have a hair transplant? Well, I can certainly help you with this question. I'm a board-certified cosmetic surgeon. I've been performing hair transplant surgery for over 20 years, and I'm also the founder of Tricostem Hair Regeneration Centers, a non-surgical solution for hair loss, an alternative to hair transplantation. So I can begin with just starting with the simple answer to the hair transplant question. And the answer is I would not recommend it. And the reason is that with younger patients who have very aggressive hair loss, there is not enough hair to restore the volume you would need to look more like your contemporaries. In hair loss, there's a general rule of thumb in that we refer to it as the rule of decades. In your 20s, 20% of men will have hair loss. That means 80% of men will have lots of hair. In your 40s, 40%, 50s, 50%. And the reality is that also that there's a certain social acceptance depending on age with hair loss. And so the expectation doesn't usually match the limitation, unfortunately, of the amount of hair available for hair transplant. Now, the onset of 15 is fairly young, so I would suspect that there's a very strong family history of pattern hair loss. If there isn't, then you should seek medical attention and have a physician evaluate you for other medical and hormonal issues before even having any kind of intervention. In our practice, we've developed a treatment called hair regeneration, and we have been using this successfully for a lot of younger males who have early onset of hair loss. But the most important thing is to first establish that this is male pattern hair loss. And if it is, and it runs in the family, well then you have certain choices. One option is the use of finasteride or Propecia. Currently, finasteride or Propecia is under a lot of scrutiny because of concerns of long-term sexual side effects from taking these drugs, and that has resulted in a lot of men choosing not to take this drug. Hair regeneration has been our solution, which we have done using a combination of platelet-rich plasma and a material called extracellular matrix. What was originally intended to use for improving our results for hair transplant, with the observation of hair thickening with this material, we developed a system and a process, and we treat patients who come from all over the world with this injection. We've actually been forced to use this treatment as an alternative to finasteride, since many men are not taking finasteride, so we can't even lean on pharmacologic support. Our numbers have been very, very good. We've had more than 99% of male pattern hair loss patients see improvement. Now, that does mean that there are some people who don't respond. There are people who don't respond as well. The numbers in those categories are smaller. It seems as a general rule, the earlier we catch somebody, the better it is. But there is a wide genetic variation with male pattern hair loss. There are men who we treat who started thinning in their 20s but still have enough hair in their 40s and 50s to be candidates of the hair regeneration treatment. And then there are men who start losing hair as young as 17 and 18 and will be bald by the time they're 22. So you can imagine that there's certainly a wide range that has to do with the age of onset and the rate of progression. But I think that I would, again, to answer the question, I'd advise you not to have a hair transplant. Learn more about the pharmacologic option as well as the newer technologies such as hair regeneration if you're going to do anything at all. So I hope that was helpful. I wish you the best of luck, and thank you for your question.